Now, in Malaysia, our natural age of menopause is around 50 to 51 years. But yes, sometimes about 10 years before that, we can actually have a few symptoms that can worry us already, the fact that menopause is coming along soon. But let me tell you that 1/3 of women actually just breeze through menopause without even knowing. So I always tell my patients that they should go and see their doctors once a year. Get a general blood check done, get a gynecological examination done, and knowing what your family history is in terms of medical problems like diabetes, blood pressure, bone problems like osteoporosis, all this can actually plan for the later part of your life. And because of the fact that our digestion is not that great, the absorption of our food and nutrients also comes down. Very important to take your calcium, and again, I'm emphasizing on vitamin D, which is actually shown to be very beneficial for even immunity and bone health at this particular stage. Of course, our skin would age naturally, as how our skin was during puberty in the 20s, 30s, and now, towards menopause and beyond that. The skin is also subject to where we are working. If we are working in an air-conditioned atmosphere, we need to take enough water. Hydration is really very important. And of course, genetics play a very important role. If your mom, aunties all have good skin, the chances are that you are going to have good skin. Now, we tend to build our bone in the first 30 years of our lives. We don't build bone after that. So the first 30 years is very important in calcium and vitamin D now that we know. Between 30 to 50 years of our lives, we have only lost about 2% of our bone. That's fine. But after 50, we tend to lose bone much more, and that's the menopause. If you take as much calcium as you want, but you don't have vitamin D, that vitamin D actually doesn't push that calcium into the bone, so there's really no point. So it has to be a combination of calcium and vitamin D. But let's not forget again, weight-bearing exercises. That means moving your weight from one leg to the other leg, because that would help impact that bone and make it much more stronger. Knowing what the family history is like. Is there a family history of osteoporosis? And if that's the case, you can check on your bones by doing a bone mineral density much earlier and working on all your supplements and exercises even earlier to help delay or prevent osteoporosis much later in life. If your cartilage and ligaments and fluid inside is not healthy, then the two bones cannot move very well. If you have someone who's always on the computer, then they might have osteoarthritis of the upper limbs even at the age of 40. We also can actually take some supplements that can help with the fluid inside the joints, which are more of glucosamine. There is also the oils that we can use, like fish oils, which can also act as an anti-inflammatory to help improve this joint and ligament quality. So this comes to our final segment. We've taken you through puberty to a woman in the 20s and 40s, especially preparing for a pregnancy. We should be looking at keeping our health going throughout our lives. So being healthy there becomes very important because we don't want to be dependent on anyone as we go along.